Fibromyalgia is a chronic condition that causes widespread pain all over the body. It's often accompanied by other symptoms like fatigue, sleep problems, and brain fog. The pain people experience with fibromyalgia is real, persistent, and can affect just about every part of their lives, from walking and working to sleeping and concentrating. Fibromyalgia affects millions of people around the world, and while anyone can develop it, it's most commonly diagnosed in women between the ages of 30 and 60. But that doesn't mean men and younger people are immune. It can happen at any age and in any gender. So what exactly causes fibromyalgia? The truth is, we don't know for sure. It's considered a neurological disorder related to how the brain and spinal cord process pain signals. In people with fibromyalgia, the nerves seem to be more sensitive, and even normal sensations like gentle pressure or mild temperature changes can be perceived as painful. Researchers believe that genetics, infections, physical or emotional trauma, and stress may all play a role in triggering or worsening symptoms. What makes fibromyalgia even more challenging is that it often coexists with other conditions. Things like irritable bowel syndrome, migraine headaches, temporomandibular joint disorders or TMJ, anxiety, and depression frequently go hand in hand with fibromyalgia, which can make the diagnosis and management more complex. Let's talk about the symptoms, because this is where many people begin their journey, usually after months or even years of feeling off without clear answers. The most prominent symptom is widespread musculoskeletal pain. People with fibromyalgia often describe the pain as a deep ache, burning, stabbing, or throbbing sensation. It typically affects both sides of the body and is present both above and below the waist. Some describe it as feeling like their body is bruised all over or like they've been hit by a truck. In addition to pain, fatigue is a hallmark feature. This isn't just regular tiredness, it's a bone-deep exhaustion that doesn't improve with rest or sleep. In fact, many people with fibromyalgia also have non-restorative sleep, meaning they wake up feeling just as tired as when they went to bed. Another common issue is fibrofog, a type of cognitive dysfunction that can include memory problems, difficulty concentrating, and slowed thinking. It can be incredibly frustrating and interfere with work, social interactions, and everyday tasks. Many people with fibromyalgia also experience stiffness, especially in the morning, as well as numbness or tingling in the hands and feet, irritable bowel symptoms, and sensitivity to light, sounds, smells, or temperatures. Even gentle pressure on the skin may feel painful. So, how is fibromyalgia diagnosed? There's no single blood test or imaging scan that can confirm fibromyalgia. That's why it's often considered a diagnosis of exclusion, meaning doctors rule out other potential causes of symptoms before arriving at fibromyalgia. In the past, doctors used something called tender point testing, where they would press on specific areas of the body to see if they were painful. That method isn't commonly used anymore. Today, diagnosis is based on a person's medical history, symptoms, and a physical examination. Specifically, the pain must be widespread and have lasted for at least 3 months, without another medical condition explaining it. Doctors may order blood tests to rule out conditions like rheumatoid arthritis, lupus, thyroid disease, or vitamin deficiencies, all of which can cause similar symptoms. Once these are ruled out and the symptoms match the criteria, a diagnosis of fibromyalgia can be made. Getting the diagnosis can be a huge relief for many people. It validates their experience. Now let's talk about what to do if you're diagnosed with fibromyalgia. The most important thing to understand is that while there's no cure for fibromyalgia, it can be managed. And managing it well often involves a combination of approaches. No single treatment works for everyone, so it may take some trial and error to find what helps you feel better. One of the first steps is education. Understanding your condition can help reduce anxiety and empower you to take control. When patients learn more about how fibromyalgia works, it helps shift the focus from frustration to action. Lifestyle changes are often the foundation of treatment. Let's start with exercise. Studies consistently show that gentle, regular physical activity can reduce pain and fatigue in people with fibromyalgia. Walking, swimming, stretching, and low-impact aerobic activities are usually the best places to start. It's important to go slowly and increase activity gradually, what we call start low and go slow. Another major factor is sleep. Poor sleep worsens fibromyalgia symptoms, and many people with fibromyalgia have conditions like sleep apnea or restless leg syndrome that interrupt their rest. Establishing a regular sleep routine, avoiding caffeine in the evening, and minimizing screen time before bed can help. In some cases, a sleep study may be needed to look for treatable sleep disorders. Stress management is also key. Fibromyalgia symptoms often flare up during periods of emotional or physical stress. Techniques like deep breathing, mindfulness, meditation, yoga, and cognitive behavioral therapy, or CBT, have been shown to reduce symptoms in some people. Therapy can also help with anxiety or depression that often coexists with fibromyalgia. Medications can play a role too, though they're usually just one part of the treatment plan. The FDA has approved 3 medications specifically for fibromyalgia: pregabalin, duloxetine, and milnacipran. These drugs work in different ways to reduce pain perception or improve mood and energy. Some people may benefit from low-dose tricyclic antidepressants like amitriptyline, especially if sleep is a major problem. However, traditional painkillers like opioids are not recommended for fibromyalgia. They haven't been shown to help with the type of nerve-related pain involved in this condition and can lead to dependency. Over-the-counter medications like acetaminophen or NSAIDs may provide temporary relief, but aren't considered the mainstay of treatment. Another invaluable tool is physical therapy. A trained physical therapist can help you build strength, improve posture, and relieve stiffness and muscle tension. Occupational therapy may help you modify daily activities to reduce strain and conserve energy. I just want to take a moment to ask that you hit that like button and subscribe to my channel. Leave a comment below if you have any questions or topics you want covered in future videos. Anyway, let's not forget the value of support systems. Living with fibromyalgia can feel isolating at times, especially if the people around you don't understand what you're going through. Connecting with support groups, whether online or in person, can provide not only emotional encouragement but also practical tips from others who've walked the same road. Diet may play a role in some people as well. There's no specific fibromyalgia diet, but many patients report feeling better when they eat more whole foods and fewer processed or inflammatory foods. Keeping a food diary can help identify triggers, and staying well hydrated is always a good idea. It's also worth mentioning flare-ups. Even with good management, symptoms can still spike from time to time. Learning to recognize your own triggers, whether that's poor sleep, stress, weather changes, or overexertion, can help you plan ahead and reduce the severity or frequency of flares. So, fibromyalgia is real, it's common, and while it can be challenging, it's also manageable. The key is a comprehensive approach, one that combines self-care, medical treatments, emotional support, and patience. Everyone's journey with fibromyalgia looks a little different, so don't get discouraged if your path isn't linear. Progress often happens in small steps. If you think you might have fibromyalgia or you've been struggling with unexplained pain and fatigue, talk to your doctor. Getting the right diagnosis is the first step toward finding relief and improving quality of life. Thank you for watching. As always, take care of yourself and make the most of your day.